is Natalie Konchak and Ashlyn Walzoff. It is February 12th at 3 p.m. Scenario is Kelly Smitty is a 33-year-old female with an admitting diagnosis of pneumonia, has a past medical history of hypertension, COPD, and angina. Most recent set of vitals are as follows. Current med orders are atenolol 25 milligrams PO, nitro paste 1 inch topical, and Aerobid 1 milligram 2 inhalations.
Hi, my name is Ashlyn Walls. I'm a Liberty nursing student. I'm going to be your nurse for today. Can I please have you state your first and your last name and your date of birth? Okay, thank you, Miss Smitty. So today what we're going to be doing is doing some medication administration. So I'm going to start by grabbing my scanner and scanning your wristband. I'm going to come over to the computer, and as I administer your medication, I'm going to be making sure that I follow the 6 rights of medication administration, which is going to be the right patient, the right drug, the right dosage, the right route, the right time, and the right documentation. So now as I scanned your bracelet, I'm going to come over to the computer. I can see the doctor's orders of the medications that I have listed, just to verify with you don't have any allergies or anything that I should be aware of. Okay, thank you, Miss Smitty. So you can see here that the doctor has ordered for atenolol 25 milligrams by mouth. So knowing an oral medication, perform hand hygiene, put on a pair of gloves, look inside your mouth, make sure I don't see any lesions or any abrasions in your mouth that would prevent us from giving you the medication. So as I come over and I check, make sure I do my 3 checks with the medication, making sure I check the chart with the medication and the computer screen, then I'm actually going to pull the medication, and I see that I have my atenolol 25 milligrams. Check that again with the computer and the chart and put it into the cup, and we would go over and administer it. But before administering the medication, I'm going to refer to my drug book. I'll look up atenolol, and I can see that this is in the class of an antihypertensive and an anti-anginal. The action of the drug is to block of beta-adrenergic receptors within the vascular smooth muscle. Any contraindications of this drug is going to be pregnancy, hypersensitivity to beta blockers, cardiogenic shock, 2nd or 3rd degree heart block, bradycardia, cardiac failure, Raynaud's disease, and pulmonary edema. Precautions are going to include breastfeeding, major surgery, diabetes mellitus, thyroid renal disease, CHF, COPD, asthma, well-compensated heart failure, dialysis, and myasthenia gravis. So that's going to be our contraindication. We're going to want to refer to nursing conditions. So with that being said, I'm going to want to be looking at the intake, the INOs, the weight, the daily weights, watching for CHF or jugular vein distension, looking at hypertension, looking at the pulse, noting the rate, the rhythm, and the quality, making sure there's no hypoglycemia, and evaluating blood pressure, etc. So with this being said, we're going to refer to their vitals, and we're going to see that the heart rate, or that since it's an antihypertensive, the heart rate or the blood pressure is 88/60. So this patient is actually hypotensive right now. So we're not going to want to administer a drug that's for hypertension. So I'm going to go ahead and document that in my nurse's notes in the chart, noting that I'm not administering this drug and relaying why I'm not. So next drug, we can see that it's going to be nitro paste. So again, doing the same thing with this drug as the last, taking the drug and referring to the chart, taking the drug, looking at the computer, looking at the chart, doing the 3 checks. Now, as far as administration of this drug, we're going to look it up in the drug reference book. Alright, now this is going to be a topical medication. So the drug class is going to be a coronary vasodilator or an anti-anginal. It is going to be some contraindications or hypersensitivity to this product or nitrites, severe anemia, increased intracranial pressure, cerebral hemorrhaging, cardiac tamponade, cardiac myopathy, constrictive pericarditis, and precautions include pregnancy, breastfeeding, children, postural hypotension, severe renal or hepatic disease, acute MI, and abrupt discontinuation and hypothyroidism. And then we're also going to look at nursing considerations before we would administer the drug, and that's going to be assessing the patient's pain, and the duration or the time that it's eating, therapeutic response, or any anginal pain, teaching the patient and the family on how to administer this drugs. Since it's going to be topical, teaching them how to apply a topical solution. So now knowing that this is going to affect the heart rate of the patient, we can look at the heart rate. Noting that the heart rate is 58 beats per minute, we're going to know that we're not going to administer this drug is below 60. However, if we administer it, we would take this solution, put it measured amount onto the piece of paper, and we would apply this solution onto a hairless part of the patient's skin, and let the patient know that it may be greasy, but tell them to avoid to not touch it. However, it could be a patch, and if it's a patch, we're going to again place the patch on the patient's arm. We're going to date and time when we place the patch on, and again warning the patient that it is going to feel greasy and sticky at times. And then the last drug that we're going to be doing, and also before we would administer these drugs, we'd want to take their vital signs before we would administer them, and I guess re-get new vital signs to make sure that these hadn't changed. And then lastly, the drug, Robid 1 milligram 2 inhalations. This is going to be used with an inhaler. So this drug was not in our drug reference book, so I'm going to refer to online. So this drug is in the synthetic corticosteroid, and it is going to be used in an inhaler. We're going to know that the contraindications are hypersensitive to any corticosteroids. Since this is going to be an oral inhalation, we're going to want to have a primary treatment of status as the further asthma. And then we're also going to want to note that the cautions or precautions of it are respiratory tuberculosis, untreated systemic infections, or ocular herpes simplex. And then last thing we're going to look up is nursing considerations. And let's see, we're going to want to note any pregnancy or lactation, and if it's, since she's a 33-year-old woman, just make sure that we don't have any problems with that, and make sure that there's no, with children, make sure that there's safety and efficacy are not established. So from here, we're going to go ahead and administer this drug. So in order to administer it, we would go ahead, scan all of our medications. So we'd scan this medication before administration. As we pull it out, we would go ahead, check with the computer, check with the chart, do the 3 checks. What I'm going to do is I'm going to take it out. I'm going to take the cartridge, stick it into the inhaler. I'm going to shake it up really well before I administer it. I'm going to go over to the patient. I'm going to have her, I'm going to take the cap off. I'm going to have her open her mouth. And before she sticks in, have her exhale. Have her put it in her mouth. Inhale. Have her hold her breath roughly for about 10 seconds. And then breathe out with pursed lips. All right, and we're going to, since this is a corticosteroid, we're going to want to offer the patient oral hygiene just to ensure that their mouth is being cleaned, because corticosteroids can, if not cleaned properly, can result in a fungal infection in the patient's mouth. And I think that's it.